All right, and turning now to tonight's medical rounds. We've seen them everywhere, urgent care centers. Hartford Healthcare has a number of them in many communities close to home. Dr. Paqui Motyl is the Regional Medical Director of Urgent Care with Hartford Healthcare. She's joining us live now to tell us more about the treatments that are being offered. Good evening, doctor. Thank you for being here.
Good evening. Thank you for having me.
So when something happens, there's sometimes a confusion. Can you tell us the difference between urgent care and the ER?
Well, the difference is that urgent care is really meant for more immediate care and for people that have non-life-threatening conditions for all ages. It's wonderful because we can offer the same quality of care as the emergency room. It's more convenient with wait times less than an hour, and additionally, we are more cost-effective with savings for the same condition up to 75%.
So just as a rule of thumb for people listening, when should you go to the urgent care?
For specifically more non-life-threatening conditions, we can see any type of medical illnesses as long as it's non-life-threatening. Injuries, since we do offer x-ray and the ability to do splinting, and anything that does not require an emergency room intervention at this time.
Okay, so something pops or cracks or something with your kids, you can head there. But what about this time of year? What types of injuries are you mostly treating at the urgent cares?
Oh, we're seeing a lot of fractures and sprains. We do see a lot of lacerations because we have the capabilities of doing suturing. Interesting, since we live in Connecticut, we're seeing a significant amount of tick bites, and we do a lot of tick removals for all age groups.
Oh, good to know you can do that. What are some recommendations to stay safe during these summer months?
Well, it's interesting because in this state of Connecticut, which is one of the top 4 for Lyme disease, we really recommend that you do apply DEET, the 20 to 30% on your skin if you're going to be going outdoors, specifically hiking. We also recommend permethrin onto your clothing, and try and avoid high grasses when you're hiking. Additionally, when you do come in, you really want to do a thorough check of your skin to make sure that you don't have a tick on you, including your scalp. And it's also good that if you do find a tick that you should, and you think it could have been on you for more than 24 to 48 hours, the CDC recommends that you come in and get a 200 milligram dose of doxycycline for prevention.
Just in case. Okay, good to know. Thank you, Dr. Motyl.